Well, good afternoon, and once again, thank you all for joining us and listening or watching from home. Today, we continue to see a rise in our cases of COVID-19. This will unfortunately be the case for some weeks ahead. Today, we want to update you on social distancing, PPE, testing, and alternative care sites. First, I want to remind everyone how important social distancing is. This virus clearly spreads when people gather together. I can't repeat myself enough. Virginians, you need to stay at home. If you do not have to leave your home, you should not leave your home. If you have to get a necessity, or if you are in a job that you have to be there in person, then go out to do those things. If you need air, walk around the block, or want to go to a local park for a jog, remember social distancing and staying 6 feet apart. But otherwise, I want to be very clear. You need to stay at home. That is the only way that we can slow the spread of this virus to give our medical system time to build its capacity to save lives. Everyone needs to stay home, and to do that for the next few weeks at a minimum. That's how long it will take to bend that curve downward. If we don't stay home, if we act like this doesn't apply to us, we will literally see more cases. We'll see our hospitals overwhelmed. It is up to each and every one of us to do our part to save the lives of our neighbors, our friends, and our family. If you're staying home and are concerned about how to get food or access services, you need to call 211. That's the state's 24-hour hotline for information on how to reach our social safety net. So far, we've seen the most cases of people are in their 50s, 60s, and older. But we're also seeing cases in people in their 20s. For those of you that like numbers, we have 604 cases in Virginia. 93 of them, 93 of the 604 cases are in the age range of 20 to 29 years. That's 16% of our cases. So there has been some talk, and I have seen activity around Virginia that this only affects the elderly. Well, it doesn't. It affects all of us. So take this seriously, and please stay home. Localities have full authority to enforce these orders, and I expect them to do so. Now, let's turn to the issue of testing and PPE. The issue is very simple. We do not have enough testing materials and personnel protective equipment for our medical staff and our first responders. This is partly due to supply chain disruptions in Asia because of the COVID outbreak there, and it will take several weeks for that to get back on track. In the meantime, our country needs a national solution. Yesterday, I was on a call with President Trump, Vice President Pence, and governors from around the country, including our neighbor Maryland Governor Larry Hogan, chairman of our National Governors Association. Working also with D.C. Mayor Bowser, we're calling on the Trump administration to set up a federal testing site specifically for the Virginia, D.C., and Maryland area. We are home to the majority of federal workers, more than 360,000 across our 3 jurisdictions, and many of them work in critical agencies that must continue to operate. We have to be able to test these individuals in real time. Our specific region needs special accommodation for testing and bed capacity to support this population. Yesterday, on that call, many governors, including myself, expressed concerns that PPE supply continues to be an issue. We're all out there bidding, literally, against each other. Here in Virginia, we're bidding against our own hospital systems, other states, and the federal government. and the federal government is bidding against 100 other countries around the world. The governors on that call repeatedly said that production and distribution of PPE really must be managed at the federal level. We strongly encourage the President to use the Defense Production Act to ramp up production of PPE. There is no time to waste. In the meantime, we've also had corporate citizens step up. Companies like Micron, Home Depot, and Dominion Energy have donated tens of thousands of PPE, and to those folks, I say thank you. For any company that has PPE they want to donate, please go online to virginia.gov/COVID-19 supplies. Let me repeat that, please. virginia.gov/COVID-19 supplies. Our Department of Corrections has made thousands of face guards. We're testing those to see what medical grade they are so we can assess how best to use them. And we're working with Virginia-based manufacturers to produce more masks and equipment in real time. Every state is doing the same thing. We're all trying to get our manufacturers to produce this equipment. But again, this really has to be solved at the national level. Now, let's talk about potential sites for emergency hospital beds. The Army Corps of Engineers has been working with our Department of Health and our emergency operations team to identify sites around Virginia that we can use if or when we need excess hospital bed capacity. I have been spending a lot of time talking to various groups, getting and giving updates on all of our efforts to work together to protect the public health. Yesterday, I spoke with our congressional delegation, and I want to thank them for supporting our request for federal funding for our National Guard emergency activities. Virginia's National Guard is helping move supplies and do other emergency logistics, and they are ready if we need to call them on further support. I've been speaking with faith leaders, business groups, doctors, hospital leaders, local government leaders, and my fellow governors, all in an effort to keep the flow of information open. As I've said before, I want to recognize the incredible service of all of our frontline workers. Our hospital workers, nurses, doctors, the greeters, everyone working in a hospital setting, our first responders, our grocery workers who are trying to keep us supplied, our truckers. There are a lot of folks serving the public right now, and we need them to keep our society moving forward. We also need to keep them and their families safe and healthy. I also want to remind Virginians about our Virginia Medical Reserve Corps. The VMCR is a force of dedicated volunteers who are ready to support the community in the event of a public health emergency. More than 1,500 volunteered just in the past month, and we had 650 volunteers in the past 2 days. I am so proud of Virginians. This kind of spirit is what makes us the best state to live in. The VAMRC is looking for healthcare professionals, 18 or older, both current or previously licensed, as well as students. So I ask you to please visit VAMRC.org if you're able to help. Once again, that is VAMRC.org. This weekend, President Trump is planning to visit Norfolk to see off the USNS Comfort, which will be deployed to New York to help that state with its coronavirus outbreak. As a Virginian and an Army veteran who served overseas treating wounded soldiers during the Gulf War, I know Virginians have always answered the call. We are home to the Pentagon, Quantico, and Naval Station Norfolk, the home port for the U.S. Navy's Atlantic Fleet. The Comfort will care for patients who need emergency surgeries, trauma care, or other medical care, freeing up beds and doctors at the hospitals in New York so that they can fight this virus. The deployment of the Comfort is a sacrifice for our personnel and their families, but I know it is one that they are ready to make. We are proud Virginia can help New York in any way. We're all in this together. That's why we continue to need everyone to stay home, stay away from groups, and do everything that you can to be safe and stop the spread of this virus. Now I'll turn it over to Dr. Laurie Furlano, our Deputy Commissioner for Population Health, to update us on the latest numbers. Dr. Furlano, thank you.
Hi, good afternoon. As of today, Friday, March 27th, we have 604 cases of COVID-19 in Virginia. That represents 144 new cases since yesterday. We have a total of 14 deaths as of today as well. I'm happy to report that these numbers will now be updated at 9 a.m. every day. We were previously providing updates at noon every day, and we've refined that process in our data validation, so we'll be able to provide that earlier in the morning. Thanks.
Thank you. One last note before we take questions. I want to thank Virginia Public Media for streaming these briefings and helping us reach tens of thousands more Virginians. On Monday alone, we were able to reach 60,000 Virginians who streamed this briefing live thanks to VPM. We have with us several reporters in the Richmond area, and today we'll be taking questions over the phone from reporters around the state, which we've planned with the help of the Virginia Press Association. So I want to thank the media for their work to help keep the public informed during this time. I'll be glad to address your questions.
Hey, hi. I know earlier this week you requested federal funding for the Virginia National Guard. What specifically would you be asking Guard troops to do? And could Virginia deploy them even without federal assistance?
It's a good question. Actually, Carlos, Secretary Hopkins will address that. Thank you, Carlos.
Thank you. And I believe your first question was the request for funding for the Virginia National Guard. And then if I'm correct, your second question was whether or not we'd have the authority in absence of federal funding.
Yeah, what specifically they would do and if they could be deployed without federal funding.
Sure. So to answer the second part of your question, yes, the Guard could be deployed without federal funding. We have various statuses for the National Guard. We have what we call state active duty, where they answer directly to the governor and they're funded by the Commonwealth of Virginia. And then we have what we call Title 32 funding, which is what the governor's request was. So the governor would still command the National Guard, but the funding would be reimbursed by the federal government. And so those are and then there's a Title 10 status where they would be fully federalized. But the request from the governor this past week was Title 32, so that funding would come from the federal government. As to what the National Guard could be doing when more fully activated, and let me just clarify, the Guard's been engaged year-round. We operate with the Virginia Department of Emergency Management, working in the Fusion Center throughout the year. When the governor activated the Guard on March 12th, that allowed us to bring more personnel onto a state active duty status. And so they've been working closely with our partners at VDH, with VDEM, and with all of the folks in the VEST to make sure that we have every resource available for this response. And so as the governor indicated, we've been helping with logistics, helping to move supplies to locations where it's needed. The Guard has a number of resources that could come to bear in the event that we see that need arise. But those are just a few of the items or the activities that the Guard could participate in.
How have you considered creating a statewide rationing criteria in the event that there aren't enough ventilators for all of the people who need them? And if so, what kind of criteria are you considering?
Dr. Carey, you want to address that?
Thank you very much. The question is, given some of the models that are out there that show the growth in the increase in the number of cases in Virginia and really all states, are there criteria that have been considered as part of our response to allocate scarce resources? And I'll simply say that based on our work with the emergency management, along with the Virginia Department of Health, and along with our hospital association, they're part of the pandemic flu plan from years ago did anticipate the possibility of that. So we have taken that plan, and we're in the midst of evaluating that. But I I would really focus on the most important thing we can do is exactly what the governor has already mentioned. Rather, is to make sure that we're doing everything we can to stop and to, or at least to slow the spread of this disease. That's where our focus needs to be. And at the same time, we are doing our contingency planning, and we're in the midst of that. But in terms of what we need the people of Virginia to do, it's to take the governor's advice around staying home if you don't need to be out. It's also making sure that if you are sick, you particularly stay home and don't go to work. So that social distancing and making sure that we keep each other safe is really where that focus needs to be. Thank you.
Governor, how realistic is federalized testing for the area? But then also, is it frustrating that the Trump administration is saying this is basically a state's problem, and the governors are all saying we need more help, and we're losing valuable time now here each day this keeps going?
I think that the question is how realistic is a federal testing in the greater Washington area. I think it's very realistic, Henry, and one of the challenges that we've had is in the supply chain, not only enough reagent, but also the swabs that are being used. And so the testing currently is through our state lab, and it's also through healthcare systems. Centera is close to being up and running. UVA, VCU have their testing that they can do locally, and they're expanding that around the state. But certainly in that greater Washington area where there's a density of population, where there are vital individuals that need to be at work every day. One of the challenges, Henry, one of many challenges with testing is the turnaround time. And at the state lab, we're doing the best we can to get the turnaround at 1 to 2 days. Some of the private labs, because they are not in Virginia, the turnaround can be 5 to 7 days. So imagine when there's essential personnel that may have symptoms, and you say, well, let's do a test and make sure that you don't have COVID-19, but by the way, it's going to take 5 to 7 days, so that person's at home being quarantined for that time. So it's not a very effective, efficient system. And so that's why the governors collectively around the country have asked for some leadership, for some direction at the national level to really help make that testing more efficient. And the same is with the equipment. The inventory of the equipment, the ability to disperse that, deliver that equipment. We really need a national system. We need direction from Washington because, as I said in my comments, states, healthcare systems, we here in Richmond, we're all competing for the same equipment, and it's not as efficient and as effective as it should be.
Governor, Democrats this year passed raising the minimum wage in the General Assembly. They also increased teacher pay.
Yes.
Where do those priorities stand now in this completely changed economic environment? And then also, why are ABC stores considered essential? Really unrelated question.
Two questions. The first question is, I think, dealing with our budget, pay raises for state employees, for teachers, for the state police, new spending. We're looking at that on a day-to-day basis with Secretary Lane, who is with us today. We're looking at the CARE Act, how much funding, how much resources will come into Virginia. So we're assessing that every day, and we'll make decisions between now and reconvene session, which is April 22nd, as to what we need to do with our budget moving forward. And their second question why are ABC stores
considered essential?
Brian, you want to take that?
Well, question being, ABC stores are considered essential. They are essential under the existing emergency operations plan, and really we're able to achieve social distancing in the ABC store environment. No more than 10 customers can be in the store at any one time, and so that social distancing, which is so important and has been the underlying message throughout this, can be achieved with respect to an ABC store purchase.
Thank you, Brian.
For Secretary Lane, I know when you spoke with us a few days ago, you said you were still looking through the stimulus package to see how much Virginia would be getting. It's now passed the House and the Senate. Can you tell us more in terms of what Virginia looks to receive from this?
Yes, the question is how much might Virginia expect to get from the recent stimulus package passed by the Congress. And I can report that right before we came in, the House did pass it. So now it'll be going to the President's desk for signature. Under the preliminary direct payments to us, it's about $3.3 billion between now and December 31st. $1.8 billion would come directly to the state. Now, those monies can't be used to offset revenue loss or can't be used for other expenditures other than those directly dealing with the COVID virus and public health. The additional $1.5 billion would go to states, to cities and localities in the Commonwealth. And any locality over 550,000, I think at least Fairfax qualifies for that, they will be able to access additional monies through this act. So about $3.3 billion. And just one thing to add to the previous question regarding about raises, there is a provision in the current budget that they are conditioned on the revenues generated at the state level. So a lot of that will depend on the revenue. And as the Governor mentioned, we're looking through those projections and how this is going to impact us going forward. Thank you.
We're now going to turn to the phones.
The conference is now in talk mode.
We're going to take our first question from David McGee with the Bristol Herald-Courier.
Yes, thank you. I want to follow up on the testing issue. The number of cases here in far southwest Virginia is very low, and there are concerns here that that's reflective of insufficient testing. And I wonder if Governor, if you could, or someone on your staff could maybe speak to how the testing resources have been deployed statewide and efforts to expand testing in response.
Thank you for the question. I'm going to let the Secretary of Health answer that. Thanks, Dan.
Thank you. This has to do with testing and far southwest Virginia. So for just the origin of the state lab. The state lab, we're so fortunate to have the state lab as a resource. They were the originator of the ability of doing in-state testing and using the resources coming from the CDC to get that up and going and available to clinicians to help better serve patients in Virginia. So we're so appreciative of that. The primary mission of the state lab is to support its public health mission and those referred by the health districts for testing, so that all 35 health districts around the state have the same criteria for testing, so that regionally all patients are treated with a similar set of criteria. So that's first and foremost. And second, the question was, again, the shortage of testing capability. With 6 or 7 each day, we get reports to the Virginia Department of Health. Because it's a reportable disease, we get both the positive test numbers and the negative test numbers. But because, as the Governor indicated, the testing from the commercial laboratories can be 6 or 7 or 8 or even 9 days, we know that there's thousands of tests out there that have not been resulted. That is, the results have not been reported. So there is a lot of testing. Is it quick enough? No. We definitely need a point-of-care testing in the medium term that can be deployed not in the tens or the hundreds, but in the thousands and the tens of thousands to do the appropriate surveillance that our public health officials would use if it were available. In the meantime, we are getting volume from the commercial labs. We are hopeful that they will be able to improve their turnaround times. At the same time, as the Governor mentioned, institutions and health systems like UVA and VCU, Centera, are standing up their own capabilities focused on inpatient testing. There really is a connection between preservation of personal protective equipment, the PPE, and the ability to find out if a patient indeed has that disease. The positive rate, both in the state lab and in the commercial labs, is only about 7 to 8%. So that's good news, but it also means that for every patient that's admitted to the hospital awaiting testing, there are a lot of patients there that we don't know whether they're positive or negative, and therefore they're using the same isolation procedures. So testing availability, testing turnaround time is key, both to understand where the disease is in Virginia and how to prevent it, and secondly, how to make sure we preserve the amount of protective equipment that we have. So again, we need commercial labs to continue to work on their turnaround times, and we definitely appreciate the health systems and our academic centers that are increasing the availability of a rapid test similar to the state lab, and that it's available within 24 to 48 hours. So thank you.
Max Thornberry with the Northern Virginia Daily.
Hi, thank you for taking our calls remotely. I've got a question about juvenile detention centers. We have one juvenile detention center out here, Bon Air, where families of the children that are in these centers are paying child support to help cover the cost of education. In those centers, education has been cut in order to prevent people coming in and out of the facility, but those child support payments are court ordered. Is the governor going to suspend those payments for those families during this time where education isn't being provided?
Do you want to address that, Brian?
Question with respect to our juvenile justice facilities and the subset of that with respect to the orders, and that is something we will pursue because since the governor's order to close schools, that did apply to our educational opportunities in our juvenile correctional centers. We have the Yvonne Miller, named after Senator Miller. We have a wonderful education center at Bon Air facility, but that is now closed. So I'll have to address the order with respect to the payments. I will say, paramount with respect to ensuring the safety of those kids at our center, and DJJ has implemented some the most stringent of reviews in assessing every 72 hours. They are screening those kids to make sure that everyone is safe and sound. So some extreme measures are being adopted, appropriate measures, and that will continue throughout this. And of course, we're, once again, with respect to the governor's recommendation about trying to reduce the capacity in all of our detention centers, jails, prisons, and our juvenile correctional facilities. We are indeed reducing that population. We're not accepting any further unless they're court ordered, and that we cannot do anything about. So, again, the population is being reduced and being screened regularly. Thank you.
Thanks, Brian.
Roger Watson with the Farmville Herald.
Thank you. We got news this morning that VCU Health is reopening a hospital that was previously closed in South Hill for COVID-19 patients. Are there any stats or models showing how much additional hospital capacity is needed in Virginia to handle the crisis?
Well, thank you. The question has to do with the fact that, been reported that VCU, and we can confirm it with VCU, is reopening a hospital with the intent of specializing either in the care of COVID-19 patients there or as an overflow for other groups of patients that can be taken out of other sites. So, and the question really was, are the model for the hospital beds. Now we're, I'm sure all your viewers have been aware there are curves and projections, and we are certainly aware of those. Our first and foremost goal is to encourage how to bend that curve so that those statistics and those potential realities don't come to pass. Our first thing, again, is to stay home, reduce maintain social distancing, to decrease the frequency and the rapidity of transmitting this virus and expansion of this disease. So that's first and foremost. But at the same time, we are looking at those models. We are very much involved with planning, along with our health systems and along with our emergency planners and along, frankly, with, as the governor has mentioned today and previously, with the Army Corps of Engineers and our National Guard. So our plans really are around helping the health systems expand on their footprint And they do, under their emergency operations plans, have those plans in place, and we are working on a daily basis, the Virginia Department of Health and Virginia Department of Emergency Management, how to support those plans with the regional coalitions. Secondly, we're also working with them on how might we use the resources of FEMA and the Army Corps of Engineers and the National Guard to build out that footprint to better meet the needs of Virginians as this crisis and as this disease continues. So we're in the midst of that evaluation to see where the best locations are, and we look forward in the days ahead of working through those plans. So again, and again, I will also say that in our planning, we need to, the biggest shortage is not just a place, there's material, PPE, and then there's staff. So we're looking at all three. And what we've heard from our federal partners is that there's no reservoirs. We see reservoir of staff from other states or the federal level that we can count on. We need to make sure through the current medical staffs and nursing and all their medical professionals that we support them in their continued work here in the Commonwealth, and we also mobilize the medical professionals that we have in the Commonwealth that could be called upon to serve. So those are where our efforts are, and those plans are ongoing. But our number one goal is to have those folks not needed, because we've done the social distancing. We've stayed at home when it is when it appropriate, and that's for all of us. Unless we're doing essential functions, we need to be at home and to decrease our ability to transmit the virus. So, thank you for that question.
Bill Atkinson with the Progress Index.
Thank you very much. Governor, this question is pertaining to the issue of the tests that you were talking about earlier. Has a special emphasis been put on getting tests to military installations around the state? As you know, Fort Lee had a confirmed case this week that really threw this area into an uproar because it's so heavily needed. Fort Lee is so heavily needed in this area. Access has been cut off to all but essential personnel, and it's just really a big business driver in this area. My question is, what, if any, reassurances or so can you give communities that are so heavily reliant on military installations that special emphasis is being put to get tests to these, all the necessary tests that are needed to these military installations?
The question is, I appreciate the question, is given priority to certain groups across the Commonwealth of Virginia, and we have in fact done that. I think if you look at the levels of priority, starting with our health care providers, certainly our military personnel would be right there with them. Obviously, they're vitally important for national security. Being able to test individuals who are in our nursing homes where the most vulnerable patients are. So, yes, we have a level of priority throughout the state as to who's being tested, and we'll continue to do that. I would like to get to the point where we can get past the where we are right now, where we need to do the screening, looking at travel, looking at exposures, contacts, looking at symptoms before you get to the actual testing, making sure that individuals meet those criteria. As we have more testing available around the Commonwealth, we'll be able to loosen up some of that, the screening versus the testing ratio.
Can we follow up when we think that might be, and what is our capacity at the moment?
Dr. Tony, do you want to address the question is when that will be and what our capacity is? Thank you.
So I'll make a couple of comments with respect to the military question, too, to follow up on what the governor said, is that we, the state lab, is in active communication with the military establishments within Virginia, and we do offer and partner with them to provide testing in the event that they need testing. The request is that they work through the Virginia Department of Health to meet the criteria that we establish for all citizens of the Commonwealth. But if they need testing at the state level, we will provide them collection kits and access to state resources for testing if they needed it. The second question was, what is our capacity? Currently, the state lab has a capacity to test about 1,800 patients. That testing, it not only supports universities, but it supports anyone within the Commonwealth that works through the health department. So it supports corrections, supports nursing homes, outbreaks that might occur in institutional settings. So we do provide a very broad distribution of testing support where it is critically needed in Virginia. We have procured and have brought in high throughput instrumentation that we are evaluating at the current time and hope to be able to expand that testing in the next week or so. It is, so right now, the current testing that we are doing is the CDC test that has been approved under FDA emergency use authorization. That is a test that requires manual processing, which means there's no automation, there's no robotics that allows us to do high-scale, high-throughput testing. We've looked into instrumentation that will allow us to process larger batches of tests at a single time, which would increase our capacity. Again, I can't overemphasize the supply chain issues that are limiting our ability to do higher numbers of testing. So they are across every manufacturer, every platform, every test system. And so we are experiencing that, as are all state laboratories and university laboratories. So that's something that we are all trying to navigate through and to have redundancy so that when one supply chain runs out or becomes back ordered, we can reflex and use a different test system.
Hi, thank you. We have a lot of road construction projects that continue in Northern Virginia. I'm curious if there's been some considerations for stopping work on road construction projects, or how the COVID crisis has impacted VDOT's ability to get these projects done.
Well, our Secretary of Transportation is here with us, Shannon Valentine. Shannon, thank you.
Thank you for that question. The federal government in nearly every state in the country has determined that construction and maintenance of highways is an essential process. At VDOT, there are about 7,700 personnel, half of which are teleworking. The other half have been pre-positioned to work on critical projects all over Virginia. I will say that any of the work that's being done is being done under very strict guidelines for safety, social distancing, hygiene. We are working on delegating equipment, trucks, various staff positions so that there is separation. So as we are moving forward with these critical projects, we are instituting safety at every step. Thank you.
Carey Hamilton?
Yes, thank you for taking my question, Governor. Your executive order number 53 orders the closure of recreational and entertainment businesses, and then it lists specific businesses. But while state parks are also listed in your closure, private campgrounds are not. In a small rural community, the opening of a campground and the sudden influx of people it entails can put a real strain on local government, and not to mention that the campground environment is one of close community interaction. So local governments are wondering what they should do.
The question with respect to parks and private campgrounds, there will be direction beginning, well, this evening, Friday, no overnight stays for our state parks, and that is the same guidance we would give for private campgrounds.
All right, Tracy
Hello, thank you for taking our questions on the phone. My question is, are any more restrictive closures or shutdowns being considered at this time?
The question is, are more shutdowns or restrictions being considered? As I've said throughout this process, we are looking at this as a very dynamic situation. It changes literally hourly. We monitor that and make decisions that we think are appropriate. So the guidelines that we have in place as of today will continue. If we need to make modifications, we will, but as of today, nothing is changing.
Staying at home is the most important thing for Virginians. Why not issue a stay-at-home order?
The question is, why not issue a stay-at-home order? Kate, we're talking semantics here. We're talking about how to enforce this. I think if you go back and listen to my comments, not only from today but from previous days, I have said repeatedly, stay at home unless it's essential that you get out. So that's what we'll continue to say. That's what our guidelines will be. If you look at whether this is a shelter at home, if it's a shutdown, it's a lockdown, however you want to describe it, we're all the states are given the same direction, and that is to stay at home.
And our last question from the phone is from John Engel.
Yeah, thank you. To the point about testing availability in far southwest Virginia and rural communities, I'll present a similar question, but in terms of PPE and medical supplies. While we know that there's that obvious and necessary emphasis on the eastern region in D.C., Maryland, that whole area, what assurances can you give rural Virginians like the ones here that they too are a priority of this administration?
Thank you, Governor. The question really is about our rural areas, of which many areas of Virginia obviously are rural, and we have very urban areas as well and suburban areas. So how can we make sure that they're not left out in the allocation of personal protective equipment? And the way by which, under emergency situations, that PPE is allocated, it is done through the local health districts. So that they know the needs of whether it's post-acute and nursing homes, or it's first responders, or it's the social service workers that need to go for adult protective and child welfare cases. They have to go in the home to keep our seniors and our children safe. Those local districts are allocated a large portion of any supplies that we get from the state to make sure that those needs are being addressed. Now, there's a shortage nationally, so that shortage will be experienced in Virginia in its locations and localities. But that voice of each health district is very much a part of our allocation.
And then last question, Laura. Two-parter for Dr. Carey.
Sorry. You were talking about capacity of testing earlier. Can you speak to capacity of beds, ventilators, and staff? And I know you said earlier the main thing is for people to try to stay home and not push the capacity. But can you speak to, say, over the next few days, do you know how many, off the top of your head, how many beds are available or how many ventilators? And the second half was, Governor, you said something about previously licensed medical professionals. Are you allowing folks to come back through this volunteer capacity to practice to help out?
I'll take so the questions were first, the second question was, with the governor's call for the Virginia Medical Volunteer Corps to come back into service. And so we've got, under emergency conditions, the Department of Health Professions has the ability to adjust that, and we're assessing our needs on how that might be changed. We have already allowed reciprocal practice from neighboring states, so that those who are practicing in good standing in various health professions have the ability to come into Virginia to serve, as long as they're in good standing in their states, for example. So we are assessing how to meet that need. the first question really was, what are the actual number of beds? We do work closely with the Virginia Hospital and Healthcare Association, and we can get you those exact numbers. ICU beds, I think we've mentioned at previous press conferences, is in the 2,000 range. So at any one time, whether it's ventilators or those beds are not fully utilized, especially ventilators are less than half of those are being used at any one time. So we are assessing the total number that we have there. We know what those are, and they're roughly 2,000 ICU beds, and there's about a ventilator in Virginia for every ICU bed. And at the same time, we are also surveying our ambulatory surgery centers and all of the areas that have breathing equipment, anesthesia machines, that under certain circumstances could be employed in the Commonwealth for ventilatory and respiratory support. So we are monitoring those, and in terms of the time course that we're looking, again, we're looking ahead every day, we're looking at our numbers, and we're really, again, encouraged by the governor's actions and what we're going to see in 7 and 10 and 12 days around reducing the likely peak and shifting the curve to the right. At the same time, as we mentioned earlier, we are looking at those projections and making sure that we're making the necessary plan. Hence, working with our hospital systems for expansion on-site, near-site, and also working with the Army Corps of Engineers to see how we might increase that supply further. Thank you.
Yes, as we approach the weekend, I just wanted to remind Virginians to be vigilant, to follow the guidelines of social distancing, washing your hands, etc. And I appreciate all of us working together. We will get through this. I want to also take this opportunity. You see a lot of individuals standing to my left and my right. They're working very hard every day. They're professionals. They do everything that they can to keep you safe. And so I wanted to take this opportunity to thank all of them. And in light of that, I thought maybe, if it's okay, this is a very serious situation, but perhaps going into the weekend we could bring a little bit of levity to the situation. And so I have had some comments. They say, Governor, you and your staff are looking kind of casual. What about the neckties? And just this is a little bit of medical trivia for you, and certainly nothing against our retail stores that sell clothing and especially neckties, but neckties actually harbor contagious pathogens. And a study was done in 2004 at a fairly large hospital in this country, and they collected the neckties and cultured them, and close to 50% of them had infectious pathogens on them. So in light of protecting my staff, keeping them healthy, and also, you may say, being comfortable, I've asked them to keep their neckties in their closets. So I ask you all to stay strong out there. We're going to get through this, and have a great weekend. Thank you so much.